and all who are gathered here. I am so delighted to be a part of this webinar, and I am very thankful for the organizers for giving this a wonderful opportunity to address about these computer applications in patient care delivery system and nursing practice. I am really overwhelmed to be a part of this program. Let's begin. You all know my topic is on introduction to computer applications for patient care delivery system and nursing practice. Here I basically focused on how computers are used in our day-to-day practice, especially in the nursing practice wise. So the entire my session is on one question: why computers in patient care delivery system? So I will be answering this question with my webinar team. So let me start one story. I just want to narrate to you all. It is a real scenario. So here we can see that two friends, Mrs. Mary and Mrs. Kamala, both completed their diploma in nursing program in 1988. During that time, I think immediately once they complete their diploma program or BSc program, immediately they had a job opportunities. So Mrs. Kamala joins as a nurse or nursing officer in the government hospital in her hometown. So she is very happy taking care of the patients, and she got married to a local person and she settled there. So she is very attending to the patient care and all the things manually she is doing and providing extraordinary care, and she is so satisfied with her thing. Then we can see Mrs. Mary joined as a nurse in the multi-speciality hospital at New Delhi. Since she got married to a person who settled in the New Delhi, so she moved to Delhi, and there she joined in one of the multi-speciality hospital, and she is also very comfortable providing care to the patients and very satisfied in work. Both are happy and things were going on like that. So after few years, Mrs. Kamala promoted as a nursing supervisor, and you know, once they promoted as a nurse supervisor, lot of tasks, multitasking things, and manually she has to attend the calls, maintaining the records, indenting, medication indenting, writing workup reports, so many things. And so initially she is able to cope up with her job. Then with that multitasking, what happened gradually, her attention to the patient care is decreased because she is busy with counting the linen, how many bedsheet has gone for washing, how many has come back, then how many medicines are stock maintaining, all the time record writing only. Though she was so busy throughout her shift period, but at the same time she is unable to unable to spend quality time with the patients or caregiver or supervising the nurses or other people. So gradually her attitude towards the nursing has decreased. The satisfaction which she had when she was a nursing officer, that satisfaction gradually decreased. When we see even the same way, Mrs. Mary also promoted as a nurse manager in that same multi-speciality hospital, but she is enjoying her thing. She is also having a multitasking, but you can see that all the things she is controlling through networking system, and everything she can sit in one area and able to finish. And she has along with job satisfaction, she could spend time with the patient as well as with the co-workers and others. So this is how she is using, and later her multi-speciality hospital is implementing nursing informatics. So she felt comfortable doing that job. Then Mrs. Kamala, gradually her thing is confined to a paper and pen, most of the time writing, checking. Gradually her nursing skills has become a clerical skills. So finally confined to a clerical job, and somehow she was not happy with the work what she is doing. So that the days are going on like that. Then whereas Mrs. Mary both completes masters in their program. So Mrs. Mary not only spending time with the patient, at the same time she can spend time with her students also. She is able to guide and also provide at the same time care to the patients also. So in 2010, it happened that both met each other in one of the functions. During that time, so they both shared their views about the nursing and how their jobs, how their satisfaction and all. Mrs. Kamala seems to be little disappointed when she heard about the Mary progress and other things. What are all the things she could achieve? Supervision, student teaching, patient care, using the digital things, all those things. Whereas Mrs. Mary is very happy and comfortable with her job. Then what happened in 2015 in India? The major decision is taken that all the government hospitals should become a e-hospital. They should upgrade to e-hospital and digitalization made mandatory. Thank God, the Mrs. Kamala felt it is very happy thing. She already have a good attitude and positive concern towards the digitalization. Then she went immediately to learn the computer course and she learned how to use the technology and other things she started implementing in her thing. So this is the Indian digital health platform. There, Mrs. Kamala can use the gadgets or digital equipment to care the patient, and most of the manual work is reduced and she is able to focus on her work and also on the patient. So this is the thing. So now what is the key message out of this story? See, now you all having not only a private or government, everyone is having access to these digital things. So here, one thing is we should have a positive attitude. We should accept that digital technology to in our life and in our practice and everyday activity. And at the same time, we have to accept. When we do these two things, automatically knowledge gain will be there. Along with the knowledge gain, skill also will be developed. So what I want to say is now gadgets or digitalization, nursing, informatics, these things are available everywhere. It is left to us how our attitude and acceptance is there towards that one. If we are more accepted, the knowledge will be gained, skill will be gained, automatically our quality of life and patient quality of life will be improved. Let's begin my presentation. At this end of the session, the participants, webinar participants will understand the role of computers in assessment, nursing assessment and monitoring of the patient, how we can take decision by using these computers, how we can do care planning, care implementation, patient education. Apart from that, how we can improve our continuing nursing education program, documentation and communication. I am mainly focusing on nursing informatics, meaning role of computers in nursing practice, communication and telemedicine, hospital information system, electronic medical records, e-hospitals in India, especially in our DIMHANS, what kind of e-hospital facility we have, how we are utilizing these computers for providing care to the patients. And very few minutes I will be talking on research updates in this area. Let's start with the meaning and with the introduction. You know that scientific advancement and technology introduced in all the specialties, not only in the nursing, in all the specialties. There is no specialty left without technology. So even if the computers have revolutionized in the nursing profession, improving the management of clinical and administrative functions of nursing. Coming to the meaning of nursing informatics, it is the application of computer information and science to promote and support the practice nursing and delivery of nursing care. So here we are using the technology to provide care to the patient. That itself is called as a nursing informatics. So the role of computer, what I have done is in my presentation, I have taken the steps of nursing process. You all know the steps of nursing process: assessment, then diagnosis, planning, implementation and evaluation. In each stage, how these computers are helpful in the assessment and monitoring and decision making, care planning, care implementation, patient education, continuing nursing education, documentation and communication. In each area, how these computers are helpful. Now, we will see for the assessment and monitoring how these technology is used. You can see on the right side one monitor. Almost everyone might have seen this kind of monitors near the patient's bedside. It may be in an ICU or emergency care unit. Presently, these monitors are used for pulse monitoring, temperature monitoring, oxygen saturation, blood pressure assessment. In some of the monitors, we can also assess the cardiac output, clotting time, and also blood glucose levels. From these monitors, we can get instant information about the patient, and this data assessment data can be used for planning of patient care. Then automatic nursing phasing. So you can see on the right side, one call mission is there. Many of the multi-specialty hospital, these call missions are there in the nurse station or in the pocket of the nurses uniform or somewhere. So what happens previously, whenever we want to see the patient condition, we have to understand when the patient is having a, what happens, our thing is attached to the computer monitor. The monitor will assess whenever the patient conditions becomes low. Maybe for example, the patient who is connected to a centralized telemetry system experiences a premature ventricular contraction. The monitor system immediately pages the nurse. Means immediately it will give a prompt to the nurse in the form of beep sound or color change. So that nurse can understand that patient is in a typical condition, then immediately he can watch or strap or in the form. We attach these things, maybe a watch.
Ma'am, you are getting frozen from time to time. Why don't you try switching off your video?
Okay, my video I have to switch off.
Yeah, maybe that's a better bandwidth issue, maybe.
Yeah. Stop my video. Okay. Is it okay now?
Yes, yes, now we can hear you.
Okay. Thing is, we can have a watches, footwear, chest strap, sensible glasses. These are sensory-based accessories which collect the patient heart rate, blood pressure, blood sugar level, etc. Anytime, anywhere. These are all the things helps the nurses to monitor the patient condition. Then we also can see nowadays handheld ultrasound devices. In the future, these handheld ultrasound devices will replace the stethoscope. With that, we can diagnose heart function, lung function, and other problems accurately than the traditional stethoscope method. So these are all the things which are there near the patient bedside or maybe a wearable gadget. How these things are helpful to provide assessment. Apart from that, we have so many assessment formats also is there. Just the nurse has to put a tick mark to assess whether patient condition is stable or not. Once we assess the information, the next one is the decision making. Computerized clinical decision-making support systems are available. The characteristics of an individual patient are matched with the computerized clinical knowledge base. And what happened here, whatever the assessment things you have taken, the assessments which you have taken, these can be given, the assessment things can be entered into the computer system. Once you enter, it will provide a base for the patient condition, then it will list out what are all the interventions the nurse can take. The decisions can be given in the form of a list or guidelines. Nurse can choose a particular guideline, can implement it into the patient condition. Then we also can have, yes, this is a system. Sorry to interrupt. My slides are moving or not? Is it okay?
Yes, right now we are at the 3D carto mapping system.
Yes.
Okay.
Mapping system, that figure you are able to see?
Yes, yes.
Yeah, this is one system where the patient things are collected from the ECG amplifier, mapping system, ECG system, and it will enter into the monitor and the guidelines will be given. Next, we have decision-making algorithms are there. With that algorithms, we can judge what is the patient condition, what interventions to be given. So the next one is, along with that, not only the patient-related information, We also can access to digital books. In some of the well-established hospitals, digital books also available in your computer monitor. From that, immediately you can refer the patient condition. Medical dictionaries, when new term is there, you are not aware, immediately you can browse in that monitor and you can get the information. Drug references guides also available. What do you mean by this drug reference? Doctor might have prescribed a drug. You want to know what are all the side effects and all, immediately you can get the instant information. Apart from that, drug calculator programs also available. For example, when the patient is weighing very less or he is a child, you want to alter the dose or reduce when you have a doubt, immediately with this program wise, you can calculate exact dose and you can administer to the patient. Apart from that, sometimes laboratory tests which you have collected can be uploaded into these monitors. Based on the uploading of this laboratory things, maybe a high creatine level or urea level, instantly the computer will give a decision making through decision making tools. It will give a guideline and you can select which intervention is more suitable to that patient. So now we have finished monitoring and decision making, how these computers are useful. Now for care planning. To facilitate the automation of nursing care process. In the care planning, we will usually choose the best one at the same time, which is more important. Some software provides even the expected nursing outcomes also. If you select that care plan, what is the expected outcome? Is that one will be suitable to our patient or not? We can judge and we can go ahead. Some of the institutions will have a practice guidelines also for the each nursing problem, so that this implementation. So we care or some few care interventions you have selected. The next one you have to implement. Even in the implementation phase also, these computers are more helpful for planning. Administering to the patient. You can see here computerized intravenous pump. It will enable the nurse to program administration rate for ordered medication. So here one, you can see on the right side, one mission is attached to the hand. In that mission, we can adjust how much the dose and how many drops. Then it will automatically that many drops and that much dose only will go. Same way it happens to the patient, controlled anesthesia pump also can be used. With that, very accurate dose can enter into the patient body, whichever we wanted. Then next one is for the implementation, medication dispensing station. These medication dispensing stations prevent from the nurse, preventing the nurses to make error. What happened? No, in this dispensary, we can enter how for which patient which drug you have entered. Automatically in the stock, it will become minus, minus, minus like that. So that at the end of the day, you know how much is remaining, how much you have to indent for the next day. These are all the things stock can be maintained very easily by using the medication dispensing station. Apart from that, nowadays air beds are attached with the computer, CC software programs, so that the same pressure can be maintained. Previously, the removing the water or removing the air, it was like a very cumbersome work and tiresome work. So now with this, with the software technology, how much air we wanted, we can adjust and it will be comfortable and it can prevent the bed sore of the patient. So apart from that, some subcutaneous pumps are there. These are usually used for the insulin and also for anesthesia purpose or pain reducing purpose. With these patches, subcutaneous patches, local anesthesia drug can be given. So this is about like what are all the things. Next one is the medication management. This is also comes under the implementation. You can see in this monitor on the left side, list of the patients are there. On the right side, one patient is visible. For example, these are all the patients who are admitted in the ward. On the right side, for patient to whom you want to administer the medication. When you click on that, what are all the drugs he is supposed to have it? For example, erythromycin, carbamazepine, alprazolam, these drugs are given. Okay, so based on that, she will know that which dose is pending, what to be given, and 5 rights can be maintained by using this type of medication management technology. The next one is, so we have completed now intervention. So the next one is documentation. You have, these computers are helpful for the assessment, computers are helpful for the decision making, care planning, and also for the implementation of care. At the end, we will be documenting. So in this stage also, computers are helpful for the assessment, care planning, treatment charting, nurses notes writing, patient charting, how to do the discharge planning, patient progress notes. In all these areas, computers are very helpful to maintain the records, very confidentiality and safety can be ensured by using these computers. Next one is the data management. You all may be knowing about this one. So for example, when the patient comes to the physician, he will order a medication. Okay, for example, the patient has come to the OPD, doctor has seen, and he will order a medication and investigation. Later, the patient is sent for admission to a emergency ward. Okay, so whatever the physician enters the lab or otherwise medication, it will be seen to a nurse station as well as in the lab or to the prescribed places it will go. So as soon as patient comes to the emergency ward, when the nurse clicks with the UGID number, the patient already biodata will be filled and some of the history also they might have collected, and you can see that immediate dose or medication what to be given, on all the instructions will be given. Same way, the information will go to the lab, where the lab technician will see what investigation is ordered for that patient. He can come to the emergency, collect the specimen, or the emergency sister can collect the specimen and can send to the lab. The lab technician will perform the test and immediately he will upload in his computer and it will be shown to a nurse station as well as to the physician. So physician also can access to nurses note what is there on how the patient condition, being in his own clinic, need not to go to the emergency thing. Same way, nurse also can see that what investigations are completed, which investigation is pending. So this is called as data management. Within the circuit of the hospital, data is accessible to all healthcare providers who are having access to that system. This is called as data management. Now, apart from that, now for the patient education also, these the computers are helpful. So through videos, we can educate the patient. Maybe a discharge, drug compliance, and lifestyle modification through videos we can explain. Apart from that, some of the hospital pre-printed or soft copies are available about the discharge planning, medication management, and home care things and all. If the patient is required, immediately you can take a print out and you can hand over to the patient. Next one is a continuing. So far, we have discussed how these computers are helpful for the patient care, data entry, data management, and other things. How it will be helpful for continuing nursing education program. Every nurse want to update or abreast with the current research findings so that we can provide effective evidence-based care. Unless until we have access to those research areas, evidence-based practice is highly impossible. Many organizations have a online continuous education programs for the nurses. Whenever we have a free time, we can join these online programs and we can finish our short-term programs and promotion or maybe a career development. So variety of continuing nursing education programs are available to obtain a advanced degrees in the nursing. Apart from that, these continuing with our knowledge, higher knowledge, we can provide better patient education, professional information, and institutional policies by using the computer. So this is how the computers are helpful in continuing nursing education program. The next one is the telenursing. I'm not going much detail about this telenursing. Here we are providing nursing services through computer and also mobile devices. Usually the telenursing is applicable when the patient is not admitted in the hospital, he is in his home or discharged from the hospital. We want to, patient has to get access of the nursing service and the physician services. So by using these nursing things, we can reduce the patient visit and it reduces the cost that patient coming and going and quicker diagnosis and immediate management can be given. Now we will see here, you can see here the nurse is talking to a patient who is discharged and being in his house, and he has connected to a monitor. So here she can ask the patient condition and how he is maintaining. The nurse can take a decision whether he has to visit to the hospital or certain minor things can be managed at home by giving the instructions. In this way, this tele-nursing is very helpful. So some areas know what happened is digital cameras are permitted in the home monitoring of the patient. For example, home healthcare agency provides a digital video camera and patient connect to a agency. The nurse assesses the patient from the beamed video signal, receives the patient vital signs and evaluates the patient progress towards the expected outcomes and provides patient education. If required, nurse can make a home visit or nurse can ask patient to come over to the hospital. So these are all the various gadgets are used to monitor the patient, and on video cameras, it is linked to a network of the hospital. Patient network is things are attached to the hospital network system. Any physician or any specialist can give information to the patient and the instructions and can guide how when they have to come to the hospital. Next, hospital information system. Many of the hospital, I already told that presently the government hospitals, private hospitals, many are using this hospital information system right from the registration. Patient can, registration is get through this hospital information system. Now they made Aadhaar link registration. With that, admission, transfer, discharge is done, billing section, medical record room, ward, operation theater, stores, pharmacy, dietary, then CSSD, biomedical waste management, payroll, and computerized clinical provides accurate results in all these areas. Once the patient enters until he discharged, everything is interlinked. Anybody can access and anybody can see what is happening in the
Ma'am, your video seems to be frozen. Maybe try switching off your video. Dr. Sreevani, can you hear us? Okay, she seems to have logged out. Let's wait for her to join back. I think some internet issues. Sorry, she just called. She's got disconnected, so she'll just log back in. Yes, ma'am, we can see you, Dr. Katyayani. Okay, great.
I am ready.
Great. We'll just wait for Dr. Sreevani to complete her session.
No problem. Let her take time.
Yeah, Sudesh, actually, we're waiting for one of the panelists. She got disconnected because of some internet issues. So we are just waiting for her to join back. Okay, Dr. Sreevani has rejoined.
Yes, is it fine?
Okay. Yes,
Ah.
yes.
No, but what you can do now I am talking on electronic medical records.
Okay. Just
I
tell
think
me
you have to check that one.
the page number. If you can just tell me the page number, I will go there.
Yeah, page number is 43.
43.
44.
Okay, okay, great. Yes. Can you see the page?
Yes, I can see.
Okay, cool.
Yeah.
Okay. Just...
Am I audible? Is it okay for everyone?
Yes, yes, we can hear you.
Yeah. Now we are sorry for the interruption. Suddenly the internet connection has gone. Then again I have to log in through another panelist. Now we will see electronic medical records. So it makes it easier for the medical professionals to record, retrieve, and manage patient data for accurate diagnosis. Once the patient data is captured and recorded in the records, it will be available immediately to the entire patient care too. This reduces the need for the physician to make trip to the patient room and to retrieve diagnosis data. So through this, all the things are interconnected, so that physician or nurse also can, in their place only, they can access the information and immediate decision can be taken. Using computers or smartphones or tablets, nurses can create and message electronic health records and update them as needed. Okay, so far we have discussed how these computers are helpful in each stages of their things. Next slide, please. Now we will see the merits. Soumya, please click on to the next slide. Yes. What are all the merits are there? Application of computers in nursing care. This reduces the healthcare cost and time, and also it makes the decision easy, improve the healthcare quality and safety, and through this knowledge is shared. As we have seen in the decision making tools, and these drug books are available. With all those things, knowledge is shared, and it improves the access to information, and this reduces the error rates, definitely, because when we are administering the medication, correct dose, correct drops, the computer can do more accurately than the human beings. It reduces the length of hospital stay. If the patient has a monitor connection in their home and other things, if he has a digital way, we can monitor. Early discharge can be done, and the patient can be monitored from his home, like through telenursing. It reduces the mortality rate. I already told that nursing call or pages, it will give the information to the nurse whenever the patient emergency patient conditions falls down. So it improves the delivery care, because quick action, accurate and error free, definitely quality care can be improved, and it improves the communication also among the healthcare members, and it maintains the data confidentiality. So because the people who have access to that, those people only can access. Otherwise, for example, if we have a file or anything, chances for misplacing the files, or sometimes patient attenders can read, or other unknown person also can access to these files. But if it is in the computer and it is a right protected, things cannot be it cannot be misused. Confidentiality can be maintained, and overall the education of the nurse, patient, as well as other healthcare team members will be improved. And with all those things, we can accelerate the research process. Next, we will go to the demerits of application of computers in nursing care. Next slide, please. Yes. Here, one of the more big disadvantage of using this technology is impersonalization of care. Means the personalized care, many times we will be with the gadgets or sitting in front of the computer and doing the things. The human touch is reduced by using this technology, and the cyber security risk. Sometimes data breach can happen, and sometimes now we happened, technology, some glitches. So what happens, because of that, I have to log out and again log in. Some frustration for the panelist as well as the people. So sometimes it will happen all of a sudden. Internet got disconnected to my computer. Do not know how it is happened. The same way it will happen also. The initial cost for these things, it is very high. And sometimes we may take longer time to adapt, because these many years we are with the manual things and all. So all of a sudden introducing these things may cause certain longer time for the people to adapt, and over dependency. We will become more dependent on these kind of things. So without these gadgets, we cannot work only. So these are all the some important delimitations I have explained. Next. So in the next session, I will be talking on how we are using computers to provide care for mentally ill patients in our Dharwad Institute of Mental Health and Neurosciences, Dharwad. Yes, next slide, please. Yes, this is a thing. E-hospitals are introduced in 2015 and made mandatory that all the government hospitals need to attach to this one. So in this thing, you can see that on the left side, there are some parameters are there. First one is the patient registration, admission, discharge, transfer, then transfer, treatment, nurses notes, administration, dietary, and laundry. These are all the things. Means these are all the activities through computers we are performing. Okay. Now, next slide, please. In the next slide, you can see, Soumya, can you? Yes, thank you. So here you can see that one example I am showing the same way admissions also. You are in an emergency ward. You want to see that at the end of the day, how many patients are transferred from your ward to other ward. So here one side you can see the UGID number of the patient, admission number, admission date, the name of the patient, and their address, age, and other things, to which ward, from which ward to which ward he has shifted. You want to see that particular patient condition, you immediately you can click on to the select, the entire patient information can be visible. Next slide, please. Then this is how the transfer procedure will take place. The next one is, when you want to transfer the patient, this is the form you have to fill in the computer, which ward you are shifting, what type of bed the patient is required. Okay, maybe a high density patient, and select the bed, and treating doctor, who is the person treating doctor in your ward, and once it will be shifted to other ward, and the patient type. So here in our hospital, the patient type is voluntary admission, involuntary admission, or de-addiction admission, like that types are there, we will be writing. So the next slide, please. Yeah, here in this slide, you can see the nurses notes, what we are using in our hospital. So here, one left side, you can see the list of the patients. List is there. 20 patients are there in that ward. All the 20 list you can see. On the right side, you can see the nurses notes for the each patient. Day wise it is there. For example, one patient I will read. Patient is irritable, increased psychomotor activity, poor self-care, over talkative, irrelevant, delusion of grandiosity present, abusive, aggressive behavior, vital signs recorded, GRBS done, and the patient is given injection, haloperidol 5 milligram and injection. So what injections you have, promethazine, that is 25 milligram is given. Like that, the entire data will be visible. Okay, so this is about the nurses note. This we are entering. The next shift nurse also can be seen this one. Even the physician also can be access to this information. What injection the nurse is given, the present patient progress is what, it can be known. Next slide, please. Yeah. In this slide, you can see this is related to drug. So on the top, you can see who are all the patient. This is one male ward. All the patient names are there. Down, you can select one patient, and down it will give a list of the drugs the patient is having. That is shown in the next slide, please. The next one is a biochemistry. In the biochemistry, so it is like from your ward, what are all the specimens you have sent to the lab for the biochemistry lab, and to which center, what is the template, and when the collection center, maybe a male medical ward or female medical ward, like that, the investigation name, what investigation, the package name, all these details when you fill, and it will go to the laboratory section, and the collected specimens you can send through attender to the lab. Next slide, please. Then next one is a laboratory collected specimen. Here the patient wise lab report, this one. So the patient type, what specimen you have collected, which lab you want to send, and from which department, that one. That information also can be entered, and it is like a requisition you are entering into the computer, and this requisition will be visible to a lab person. Next one. Yeah. Here you can see the list of drugs. Yes, for example, the doctor might have ordered for your patient amusulfide drug. Okay. So you want to know that whether it is available in our hospital or not. So when you click on to the drug master list, all the drugs which are available in our hospital, it will give a list. For example, acomprosite calcium. So you want to check whether it is given in alphabetical order. It is easy for you to check whether the drug is available in our hospital or not. Based on that, you can take a decision whether that drug can be administered, or otherwise, if it is not available, can be returned to a patient and he can get from outside and can be administered to the patient. So this is one facility. Even if it is not there available in the main store, what drugs is there also, it will give a list so that it will be helpful. So whether stock is available or not to know. Next slide, please. Yeah, this is a diet prescription. So maybe a doctor might have prescribed iron-rich diet or high-protein diet or salt-restricted diet. So you have to fill patient UGID number, name of the patient, which ward, maybe a female chronic ward, diet type name, salt-restricted diet, which day you wanted, bed number of the patient. This will be visible to a kitchen person or a pantry section. So where that how many patients salt restricted diet is there for them, they will get a separate diet and they will serve in the ward. So this is one provision. Next one, please. Yes, this is a laundry. In the initially itself, I told admission, medication administration, nurses notes, dietary, laundry. Then we have 6 areas. These e-hospitals is attached. Laundry, in the laundry here, like you are putting an indent through this format. So we have 3 types of laundry for the patient. Linen, one is white, another one is the maroon color, another one is the green color. Alternative days we will be changing this one. So whenever we need a indent, you need a maroon bed sheets, then you can write in that maroon bed sheets for this ward, this much is there. It will go to the laundry. The laundry person will send through attender to particular ward, so that no stock register can be maintained, how many times you are sending for the washing and how many times the thing has come. All the stock will be maintained through computer only. Next slide, please. Yes, these are the specific formats which are prepared for mentally ill patients, specifically in our hospital only. These formats will tell you, the nurse has to just put a tick mark, yes or no. Sleep, adequate, increased or decreased, appetite is decreased or increased, personal care, whether it is maintained or poorly maintained. The nurse has to just maintain a checklist every day. This is a biological function. Okay, next one more slide, please. Next slide, please. So here, this one is the mood symptoms. These mood symptoms like a sadness, elevated mood, hopelessness, worthlessness, helplessness, increased activity, high self-esteem, low self-esteem, lack of interest in work, anxiety. These are all the things are given. It is very helpful for the nurse. Just she is going on putting tick mark so that it is visible to the treating doctor also, so that he can gauge the mental state of the patient, so that drug increasing or decreasing can be done. Next slide. So this is for specifically designed for OCD symptoms. Here, the fear of contamination, whether present is not, repeated washing is there or not, checking behavior is there or not. With that, we know whether how many OCD symptoms the patient is having. So these can be marked by the nurse, or sometimes junior residents also can mark these things, but we are following, our nurses are marking these things, and very systematic assessment we are doing for the patient. We also have a formats for the physical examination and general prescription, patient progress report. Patient progress report already I have shown to you. Next slide, please. Yeah, this is for the vital signs. In that vital signs, temperature, exact temperature we are marking. BP we are recording, respiratory rate, pulse rate, heart rate, height of the patient, weight. In the beginning only height, weight will be there. Same thing will be continued. So oxygen saturation, if it is required, those details also you can enter. So biological things, vital signs, and also mood status, OCD symptoms, like that many formats are there. We can use these formats through computer and we can mark the patient condition. Next slide, please. Yes, this is about the drugs. For example, for one patient, you want to administer. What are all the drugs are given for the patient? It will come a list on the left side, latate, risperidone, sertraline, sodium valproate, triaxiphenidal, like that list will come. So which is having a SOS medication or PID medication, you can click on that, and that shows that that particular medication you have administered to the person in so and so time. So on the top, you can see that for that patient, they have given on 26th dates are given. So on 26th, you have given this medication, means the tick mark will come, so that you have administered the medication. So drugs also we are entering through this as well as we have administered. Same way, the drug when you are administering in the stock register, it will become a minus and stock will be maintained automatically. Next slide, please. In the next slide, it is like a one drug when we have given, this is like a sub-stores, the receipt will go like that. The risperidone for one patient, today it is given in the stock, it will be going on reducing. And next slide, please. Yeah, so here bedsheet indenting, this is a indenting form. Next slide. Yes, so far I have explained in our hospital what are all the things we are doing through computer. As I already told that admission, discharge, transfers, then also nurses notes, medication administration, maintenance of drug registers or drug stock, laboratory things, then dietary and this laundry. There are 9 sections are interconnected with, and also billing section. There are 10 modules we have implemented. All the things are interconnected, and the patient, once he takes some investigation, the amount will go to the billing section. At the end, the nurse can see how much bill is there. She can pass on information to the patient, and he has to go to the discharge section and he can pay, and he can get relief from the hospital. How the 3 hospitals are functioning. Now, I will just touch on certain things that in the literature, what is available. The impact of electronic health records on time efficacy of physicians and nurses, a systematic review. This study proved that so electronic records, definitely time efficiency is improved for the nurses as well as the physicians. Next slide. So this is another study. It shows that impact of health information technology on patient safety. So this study proved that patient safety definitely improves by implementing health information technology in the hospital. Yeah, another next slide, please. This is a third study. Here I have focused on systematic review, impact of health information technology on quality, efficiency, and cost of medical care. So 3 research studies I have enclosed here shows that these implementation of computers are very effective in improving the patient condition. The next one, I would like to summarize my topic. I have initially covered on, I started with a case scenario, what kind of attitude we need to have, how the knowledge and skills are related with the attitude. Then I explained the role of computers in assessment, then diagnosing, then care plan, implementation, documentation, as well as next one is documentation. After that, healthy informatics systems. Then I also told about telenursing, then case these electronic health records in our hospital, how our e-hospital is functioning under 10 areas, how we are using these computers for providing care to the patient. So now we come to the last slide. So now you can answer why these computers are helpful in patient care delivery system. Obviously, it improves our efficiency, accuracy will be increased, it utilizes the resources, it saves the time, it saves the expenditure also. The data can be used for the research purpose. Okay, so let me